There are lots of different treatment programs for balance conditions, and each balance condition will have a different specific treatment, and that's important. There's not one size treatment fits all, and that's the danger of the internet. And the second danger of the internet is getting the wrong diagnosis. So very, very many people who come have read the internet thinking that fits my diagnosis, and it's completely wrong, so they're going up the wrong path. Now, for the commonest cause of balance disorder, vestibulopathy, caused by vestibular neuronitis, we use a program of exercises that get the eyes, the brain, and the ears talking to each other properly again. So the key reflex of balance is the vestibular-ocular reflex. Vestibular is balance in the ear, ocular is your eye, and there is a nerve pathway that goes between your ear and your eye. And as I showed earlier, it is the nerve pathway that allows you to focus like this. Now, when you walk, you do not see the horizon bobbing. If you had ear balance organs that weren't working, the world would bob like this. It's called oscillopsia, like an old camcorder on your shoulder, walking like this. And if you have damage to both inner ears, that's what you'll experience. Now, the vestibular-ocular reflex very subtly moves your eyes, the image on your eyes, as you walk. You're not aware it's happening, but it stabilizes your image, and it allows you to turn your head quickly from side to side. I can do that without any problem arising. So what we do is we stress it. We identify that pathway that's not working, and we work with it. So if, say, you play golf, and you develop a slice, you go to your golf tutor, who says, no, hold it like this, and hit it a different way, and you feel really cat-handed to start with. But you go and hit that ball 1,000 times in the driving range, and suddenly, that new grip, that new swing, feels normal. And the reason it does is you have set down a new neural network in your brain. Think of it as a printed circuit board in your brain that you've changed the wiring on. And the way the brain learns and adapts is through repetition. So if you've got a child learning to speak, you'll go mama, 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 and you'll repeat that word again and again and again. And if you have a stroke, you'll exercise your arm again and again and again. And what you're doing is laying down new neural networks in the brain. So for balance conditions, the way we're doing that is with exercises, for example, like this to start with, repetitively, again and again and again, over days and weeks and months, to realign the neural networks, the brain pathways between the eye and the ear and the brain. And that's the basis of vestibular physiotherapy. And then we'll tailor the exercise program to what is going wrong in your balance system. And we have special tests where you go into a room where floor and walls move, which will help us to identify which bits of the pathway aren't working properly. But that's just one type of problem. So we have crystals in the inner ear, BPPV, where patients are incredibly distressed, violently dizzy, often lying down in bed, rolling over and sitting up. We can lie you down on the couch over here, I can do that, and in 2 minutes I can cure the great majority of my patients. And I regularly see people who have had this for 30 or 40 years, who have almost been housebound for that length of time. And I lie them down, spin them over, do a little manipulation and sit them up, and they're cured. And they don't know when to be happy, whether to cry, to be angry. What reaction do you have? How have I possibly had this for 30 or 40 years? And you can cure me in 2 minutes. But we can do that. Can't necessarily stop it coming back, but we can cure it there and then. And there are other conditions. Migraine, massive problem. The number of people whose vertigo and general life misery I have sorted out by asking them to stop drinking caffeinated drinks. I can't tell you, it's a huge, thousands of people. When you get older, sorry to say, your body doesn't tolerate caffeine as well as it did when you're younger. And that can drive migraine. And you may not be aware that your dizziness is caused by migraine. And there are lots of medicines you can use for migraine. But lifestyle changes, not skipping meals, sleeping well, lots of things you can discuss with migraine. With Meniere's disease, my team and the team in London at Imperial published a landmark paper in The Lancet just before Christmas. We can now inject drugs through your eardrum into your inner ear. fabulous treatment. This devastating condition of Meniere's disease with vomiting, hearing loss, vertigo, tinnitus. We inject a couple of injections through the ear under local anaesthetic in the clinic here, and at 2 years post-treatment, there's an average 90% reduction in vertigo. It's extraordinary, absolutely extraordinary, the advances that we're making. And we're working with an American company at the moment, injecting a gel into the ear to try and produce similar results as well. And if you develop dizziness and a balance problem, firstly, be reassured that it's incredibly common. And there is actually a lot of help, especially if you're living in Leicestershire, you're in the right county to get dizzy, and go and speak to your GP. Be cautious about the internet, because you can absolutely be led down the wrong path. And remember that most people writing on the internet are people who haven't got better, who have not been well treated or very seriously affected, and that may well not be you. And if your GP is not able to offer you a diagnosis or treatment, and many GPs offer an excellent service in Leicestershire, really do, and can treat many of these conditions themselves, then you can be referred over to the Balance Centre at the Leicester Royal Infirmary if you're on the NHS, or at London Road Clinic if you're paying for it. And what we will do is we'll go through the story and we will identify those factors causing your dizziness. And there's likely to be several different factors causing it. And then we'll put a program together to treat each element of those balance problems, assuming it's an inner ear balance problem. And if it proves to be something else, there's lots of other things that can cause it, from diabetes to heart problems to blood pressure to stress to goodness. There's a whole list you can go through, and you have to get the right diagnosis. And then once you've got that, if appropriate, you can be guided on to others who would be more appropriate to treat it. But the great majority of patients who come and see me have got a problem with the inner ear.